So for the next blood vessel which we are looking at its clinical importance, is we try to look at the clinical importance of anterior interosseous vein. So let's quickly try to pinpoint the anterior interosseous vein. So this is the anterior interosseous vein, okay, right on top of the what? Interosseous membrane. Let's look at it again. Okay, no, this one I just brought a picture to depict something. No worry, we'll come back to it. But this is anterior interosseous vein, right? So anterior interosseous vein, its clinical importance include it can be affected by deep vein thrombosis. Now see, it is a vein of the upper limb, but it can be affected by deep vein thrombosis where there's thrombus formation. Forget that I brought a picture of the lower limb. Don't worry. Okay, just take it as though it is in the upper limb. All right, I just brought it just to depict what deep vein thrombosis. So deep vein thrombosis, they usually occur in the lower limb, but it could also occur in the upper limb too. Okay, so they're actually rare compared to lower limb deep vein thrombosis, but you don't rule them out. They could actually still occur. So it can occur in the setting of the upper extremity. So there's a lot of pain, there's a lot of swelling, there's a lot of venous congestion in the forearm, and this could actually mimic superficial thrombophlebitis. So risk factors: central venous catheters, repetitive forearm use, and systemic thrombotic conditions. So surgical significance, relevance is forearm surgery. Okay. Once you are doing the surgery around the forearm and around the interosseous membrane, like all those radius fractures, ulnar fractures, just know that a vein like that exists there. Okay. So there's risks of injury during surgery, so you should know the anatomy of this vein so that you don't injure it. Okay, it can also be harvested. Okay, if you want to actually do some 1 or 2 microvascular surgeries. So collateral circulation, of course, it connects with other veins around here. You can see the network. Okay, so together they form that rich blood network around the elbow downward. Okay, so they form the deep venous network of the forearm, providing collateral pathways when superficial veins are obstructed. They also help to maintain venous return in cases of proximal obstruction, may enlarge or become prominent in chronic venous insufficiency. Okay, so that's what we have. They also help in venography and also those magnetic resonance venography.